Hey 301ers, welcome back to Module 11. We're going to be talking in this video about exercise testing for clinical assessment. Of course, if we're looking to assess the people that we're working with, the one test that's going to come to mind, hopefully, especially with all the emphasis in your laboratories, is graded exercise testing, otherwise known as GXT. And you remember that with the GXT, we make things harder in a graded way. So we start very easy in the test and we eventually make it harder and harder. And given the case of a maximal test, we make it so that it's so hard they can't perform the exercise anymore. And the importance of this is because when we make exercise harder and harder, we're stressing all of the different organ systems that I spoke about in the last video. And by stressing all the organ systems more and more and more, what we're doing is we're looking to find those weak links into the chain so that we can identify problematic areas within our bodies, the weak areas that can be improved with exercise, so that we can take that information and actually prescribe exercise. Where are some of these weak links in the chain? The heart is a huge weak link in the chain. We can assess this with electrocardiography, ECG, to understand where in the heart there is a problem. Is it the atria? Is it the ventricles? Is it with the blood supply? Is it with the conduction system itself? Many different problems that don't really come out until we exercise. Oftentimes, heart functions properly during exercise, and we have no indication that there actually is an underlying issue in the heart that's just waiting to come out someday, and we don't want to wait for that issue to actually come out. But we can use exercise to bring those out, even just briefly, so that we can get a glimpse into what's going on into the heart now, early, where there might be a minor problem so that we can prevent that major problem from happening later. In fact, exercise can uncover about 80% of so-called silent abnormalities. So exercise can bring out 80% of those that we normally wouldn't have any understanding of if we never did a graded exercise test with an individual. Another thing that can come out with exercise is angina pectoris, again leading to some cardiovascular issues, but graded exercise testing is very, very good at having this chest pain come about in a repeatable fashion. And we talked about some of those factors in the cardiovascular section, but exercise is very, very good at doing that, and also assessing as to if that chest pain, that angina pectoris, is getting better when we incorporate an exercise training program. Of course, hypertensive responses to exercise are good outcomes from a well-designed exercise program. And in the exercise test itself, if we are measuring blood pressure, as you should, you'll remember that there are certain changes that are supposed to occur, right? We have aerobic exercise with systolic blood pressure that goes up with increasing intensity, but diastolic stays the same. We understand there are some different responses with resistance exercise, but being able to detect these abnormal blood pressure responses to exercise gives us some more insight into, again, mostly the cardiovascular system, but what is going on with our physiology that isn't quite working right so that we can do something about it. And lastly, a big one with exercise is just getting some general feedback during the graded exercise test or following the graded exercise test on any things like musculoskeletal pain, any pain specific to certain joints, what types of movement exacerbated those particular pains, so that we can pinpoint what's going on in the musculoskeletal system. And in regards to learning about what type of underlying conditions might be with someone, we can also use graded exercise testing to help us better prescribe exercise. So you can, of course, tell people, hey, go be physically active, or hey, just go start walking, or go to a gym and start lifting some of those heavy things. But when we take our exercise testing, and for example, a graded exercise test, you get to see their heart rate response. You get to see their metabolic response through the gases that you are collecting. You get an idea of their rating of perceived exertion at the different levels of exercise. And then, given on what type of energy systems that you're trying to incorporate with an individual, or perhaps an individual has no background in exercise, or maybe they do have a background in exercise, you can take all of those data points that you're collecting during a graded exercise test to help better write that exercise prescription for an individual. Another thing that you can do is you can use graded exercise testing to monitor any dietary changes that are being incorporated in someone's diet, pharmacological changes that have been prescribed by a medical doctor, or even surgical interventions. By using a graded exercise test at certain intervals, whether it be 4 weeks, a couple months, or even a year later, help give us a clue as to whether or not those dietary, pharmacological, or surgical interventions are actually doing what they're supposed to do. And lastly, considering those biomarkers for premature death, or even if you want to relate them to quality of life, just assessing those biomarkers themselves, the aerobic capacity of someone, the 1 repetition max, or any other strength measurement in someone, allows us to see where someone is right now in regards to their risk for all of these disease states related to exercise, or even just premature death in and of itself. It should be something big that gives you a way of encouraging people to be physically active. It's very, very important. So the previous slide and this slide is looking at all the different ways we can incorporate exercise testing, whether or not we're trying to diagnose and peer into any underlying issues that a person might be encountering, or monitoring any sort of different intervention that is going on with that particular individual. It's a very, very powerful tool that you can take with you no matter who you're dealing with or in what environment you're dealing them in. Something I wanted to note here is the ability to utilize electrocardiography with exercise testing. When you guys were doing this in lab, you are all young, physically active, vibrant, healthy individuals, and therefore when you were monitoring the ECG, you saw a normal PQRST, which I hope happened. Maybe you guys saw something else different on the ECG, but in general, I think it's safe to say it was all pretty normal. But that is not always the case, and I can definitely say this for sure because I did a lot of ECG graded exercise testing when I was at the Ohio State University, and you do see a multitude of odd ECGs, if you will. And if you take an ECG class, you're going to learn what all those abnormal ECGs, the differences in the waves that you see, how that is able to give you information to interpret what is going on inside of that person's heart. So for instance, here we have what's called ST segment depression, right? We have QRS, T, but normally this S comes back up to baseline as we move into the T. So we have some depression here. And in this particular case, about 2 millimeters of depression. And if you see that on a graded exercise test, you might not see this at the very beginning. And you might not see it at stage 1 or stage 2 or stage 3, but you might see it at stage 4. And it gives you an idea of what's happening in the heart. In fact, when you see ST segment depression, this is showing us that the person might be encountering myocardial ischemia, right? So they are having issues in getting that blood supply to the heart to give it what it needs to keep functioning during this highly stressful activity the graded exercise test that you're doing with them. Of course, this is an instance where you would not be progressing them through the exercise anymore. There's a whole long list of contraindications for continuing on with an exercise test that you'll learn in a more advanced later class as well. And to give you another instance of something that you might see fairly readily during exercise, it's called a premature ventricular contraction, or a PVC, a premature ventricular contraction, a PVC. And you might see these during exercise, and more often than not, it really doesn't mean anything. They're kind of rare and fairly inconsequential in normal individuals. But if you start seeing these more frequently, sometimes you'll see one happen every so many beats. You'll see sometimes they happen twice in a row or 3 times in a row. These all are more important to observe because they generally mean that there's some arteriosclerotic heart disease going on or a myocardial infarction. So, you know, if you're ischemic and you're ischemic long enough, you're going to have a myocardial infarction, which is a heart attack, and you have death of your muscle cells, and we don't want that. And here's what a PVC looks like. You can see that we have here a P wave, a QRST, and it looks fine, right? But look what happens here. You're supposed to get another P wave, say right about here, but what happens? You can see that there is interruption, right? It happened actually before the P wave. The P wave should have happened right about here, let's say, if you were able to measure this out. And some electrical activity happened very, very quickly. And you can see how it's looks like an R wave, but it's inverted. And that's telling you that the direction of this electrical activity is in the wrong direction, right? And it's happening in the ventricles. And that's why we call it premature. It happened early. Ventricular contraction. This is where the ventricles contracted before the atria. And go back to your knowledge about the cardiovascular system. What do you think it means if the ventricles are contracting before the atria? Remember the importance of that lub-dub, 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 where you have the atria contracting right before the ventricles, and that's so that you can push that blood into the ventricles. But if you contract the ventricles before that happens, the volume of blood that you're able to eject through the system is decreased quite a bit. So that's an important aspect to look at. And these are just 2 of the many, many, many examples of how ECG can be used to analyze the heart during exercise. It's a fantastic technology, and I really encourage you to move forward and try to look into learning ECGs more in depth. Okay, so as we're wrapping up here, I want to sort of bring a lot of your lab back into class here with an example from your book. This is also from Chapter 18, Clinical Exercise Physiology. And this is a chart that brings together essentially what I would want you to do with the individual clients that you're working with. You could just as easily make an Excel spreadsheet or a computer program that would do something like this. It might be complex to do, but nevertheless, that's what you're getting paid to do, right? You're getting paid to assess physiological information and translate that into better exercise prescriptions and recommendations for your clients. So I want you to be thinking like this. So basically, we have a chart here, right? This is graded exercise test time in minutes, and up here is the heart rate response. And you can see that looks like there's some points here taken about every minute for heart rate until there was an end to the graded exercise test. This was actually a Bruce protocol test, the one that you guys do in class. And B here is a line. It's just a best fit line that goes through all of those points. And what we did here in C, or what the authors did in C, was create a target heart zone of 60 to 75% heart rate max. Not a terribly hard intensity, but it's one that will get this person started in their exercise program. So when we take this desired heart rate zone, what's really cool about this particular figure is they've incorporated how someone would exercise with walking, jogging, or running, depending on how well they did on the test. You can see if they went out further here, then they would be more to a jog or perhaps a run. But this particular individual in their heart rate zone comes down to almost up to a jog, but it's a very, very fast walk for this particular individual. And this gives them a time in minutes per mile. So the very minimum exercise that they should be doing is about 15 minutes per mile. And the next line here, E, shows us metabolic equivalents. And I know you talked about that in your lab, but metabolic equivalents are really, really important for us to understand here. So these are referred to as METs, but you should know that those are metabolic equivalents. So that's how that all works together here. And it gives us a really great way to understand and interpret what we know as VO2, so how much oxygen someone is using, to something that's more easily digestible for individuals that don't quite understand that much about exercise physiology, and that's completely okay. That's why you guys are here. You're helping them interpret that into meaningful and useful information. And that relationship is here. And that's one metabolic equivalent equals 3.5 milliliters per kilogram per minute of oxygen consumption. Yes, you need to memorize this equation here, right? This conversion. One metabolic equivalent equals 3.5 mLs per kg per minute, which is resting oxygen consumption. It's relative, so it's same for all of you. You're sitting here listening to this lecture, unless you're exercising, which is cool, but if you're sitting here resting, you are consuming about 3.5 milliliters per kilogram per minute, and it doesn't matter if you're 50 kilograms or 150 kilograms, because it's relative, okay? So that's really, really important. This one MET, this 3.5 milliliters per kilogram per minute, is resting oxygen consumption. And so this gives us a way to give an intensity prescription to an individual, because a lot of the treadmills, a lot of the cycles and other exercise equipment out there will pump out this number for you, METs. So if you set it up and you hit that button on units, METs will come out. So you can say, hey, look, so-and-so, based on your test, I want you to be working between 4 and 6 METs. And I know your cycle ergometer does that. So make sure you're looking at that MET unit and keep between 4 and 6 METs. It's a really awesome way to get people to exercise at the intensity you want them to. And then to get an idea of energy expenditure, which is usually a very important factor when we're trying to look at how much food someone should be eating, or if we have an athlete and they're exercising a lot, we need to know how much energy they're expending so that we can match that or exceed that if they're trying to maintain or put on muscle mass. And so we have metabolic equivalents to how much energy expenditure that is going on with that exercise. And one MET, this is nice because it's a really easy value. If you really want to make it generic, you could get it in your head as one MET equals 1 kilocalories per kilogram per hour. Or if you want to be more exact, and this is academic class, so be more exact, is 1 MET equals 1.05 kilocalories per kilogram per hour. You need to make sure you get that in there. I hope I said that correctly earlier. But that's kcals per kilogram per hour. This is another conversion that I want you to know, because this is something that you can use. When you go to the rec center and exercise for a half hour at a certain MET, and you can calculate, you can see how many calories that you're burning. Okay, it's a very good thing to do. And it's especially good when you're prescribing METs in regards to non-exercise equipment. If they're playing a sport or something and you know a certain intensity is a certain MET, you can calculate approximately how many kilocalories that they're expending. It's a very, very useful tool. And lastly, there's one more conversion that I want you to know. And this is in green here because it's very similar to what you can get here with the METs. But let's say you have the oxygen consumption data, and you do because you ran them through a VO2 max test. Every liter per minute, absolute oxygen consumption here, not relative anymore, absolute. So 1 liter per minute equals 5 kilocalories per minute of caloric expenditure. So you can convert that too if you know how much oxygen they're consuming. So given that graded exercise test, right, you have how much oxygen they're consuming in liters per minute. You can convert at this first stage of exercise in the Bruce test how much energy they're expending given that intensity. And so if you tell them to go walk at that same intensity, then you can get a great idea of how much energy they're expending. So let's take this example. Given that your client weighs 132 pounds, think of that conversion, how many kilocalories are they expending if exercising at 4 METs for a half hour. Yes, I want you to try this out. Can you get the right answer with a client that weighs 132 pounds, convert to kilograms, of course? How many kilocalories are they expending if you told them to exercise at 4 METs for a half hour, 30 minutes? I don't know if this is going to be a hint or not, but anyways, I want you to calculate that out, see if you can get that answer so that you can prove to yourself that this is something that you understand. And that brings me to the end of this module. I hope you enjoyed the ability to think about all of that hard science that we learned. It's exciting, and it should be fascinating for you, even if exercise science isn't your major. It should be interesting to learn about truly what is going on at the very cellular and tissue level that happens when we exercise. I hope you take that interest and that fascination with you, whether you are exercise science or not, and think about how it affects your ability to better interact with your clients and prescribe exercise. It's really something that will set you apart from those individuals that do not understand this underlying science. So thank you very much, and good luck in getting ready for your exam. Take care.